Hi everyone! In today's lecture, we are going to discuss two coding manuals, the ICD-10-CM and ICD-10-PCS. We'll be covering the basics of these two coding systems, their structure, and their importance in healthcare. By the end of this session, you will have a solid understanding of the role ICD-10 plays in medical coding, healthcare reimbursement, and compliance. By the end of this lecture, you should be able to 1. Understand the history and purpose of ICD-10. 2. Differentiate between ICD-10-CM and ICD-10-PCS. And 3. Recognize the importance of accurate coding for healthcare reimbursement and compliance. Let's start with a bit of history. The ICD system, or International Classification of Diseases, was developed by the World Health Organization, WHO. It was originally created to track health statistics, such as mortality rates, and over time evolved to support the coding of diseases and procedures. The current version, ICD-10, was introduced by WHO in 1993. In the United States, we currently use the ICD-10-CM and ICD-10-PCS. In 2015, we replaced the ICD-9 version with ICD-10. This change was necessary because ICD-9 was outdated and lacked the specificity needed to describe modern medical conditions and procedures. It's important to remember that the ICD system is constantly evolving to keep up with advances in medicine, so coders must stay informed on updates and revisions. Now, let's dive into the first component, ICD-10-CM. This stands for International Classification of Diseases, 10th revision, clinical modification. The ICD-10-CM is used for coding diagnoses in all healthcare settings, whether inpatient or outpatient. ICD-10-CM codes are alphanumeric and can range from 3 to 7 characters. The codes are organized into chapters, with each chapter focused on a specific body system or disease group. For example, there's a chapter for diseases of the respiratory system and one for cardiovascular conditions. For instance, the code J45.909 represents unspecified asthma, uncomplicated. Each character in the code tells us something specific about the patient's diagnosis. The second component, ICD-10-PCS, is the procedure coding system, hence PCS. This system is used only in inpatient settings and is designed for coding procedures. It's highly detailed and uses 7-character alphanumeric codes. Each character in an ICD-10-PCS code has a specific meaning, such as the section of the procedure, the body system involved, the root operation, and any devices used. It's a much more structured and detailed system compared to ICD-10-CM. For instance, a code like 0FB03ZX represents a biopsy of the right lung, percutaneous approach. Each character, or digit of the code, tells us something specific about the procedure, such as the method of access and whether any instruments or devices were involved. Now, let's simplify and clarify the key differences between ICD-10-CM and ICD-10-PCS, two essential coding systems that work hand in hand but serve different purposes. First, ICD-10-CM is for diagnoses, basically, what's wrong with the patient. You'll use it in both inpatient and outpatient settings, from hospitals to doctors' offices. So whether it's a broken bone, a chronic illness, or a minor infection, ICD-10-CM helps you pinpoint and code the diagnosis. In contrast, ICD-10-PCS is all about procedures, what's been done to treat the patient. This system is only used in inpatient settings, like hospitals. If a patient undergoes surgery or another procedure during a hospital stay, you'll use ICD-10-PCS to describe what was done. ICD-10-CM codes can range from 3 to 7 characters. They start general and get more specific as you add characters, things like which side of the body is affected or if it's an initial or follow-up visit. On the other hand, ICD-10-PCS codes are always exactly 7 characters long, and each character provides specific details. You'll see everything from the section of the system, like surgery or imaging, to the body system, the approach, and any devices used. ICD-10-CM focuses on diseases and conditions, what brought the patient in. ICD-10-PCS focuses on procedures, what was done to the patient. One explains the why, and the other explains the what. It seems simple, right? Look at the organization of these manuals. ICD-10-CM is broken into chapters based on body systems or diseases. ICD-10-PCS is organized into sections based on types of procedures like medical, surgical, or imaging. Always remember, ICD-10-CM tells the story of the patient's condition, while ICD-10-PCS describes what was done to fix it. Both systems together give us a complete picture of the patient's care. ICD-10-CM is what is wrong with the patient. Why are they being seen today? While ICD-10-PCS explains what was done to treat the patient. This distinction is crucial when coding medical records. What is the purpose of ICD-10 in healthcare? Well, now that we understand the structure, let's look at why ICD-10 is so important in healthcare. First, it helps us document healthcare services. ICD-10 codes represent the diagnoses and treatments a patient receives, which is critical for creating accurate and complete medical records. Second, ICD-10 is essential for billing and reimbursement. When a healthcare provider treats a patient, they use ICD-10 codes to communicate with insurers, who then use these codes to determine how much to reimburse for the services provided. ICD-10 also plays a big role in public health tracking and clinical research. By standardizing the way diseases and procedures are coded, it allows us to track trends, identify emerging health issues, and support research efforts. What is the role of medical coders in reimbursement? One of the most critical roles of a medical coder is ensuring that codes are accurately assigned so that healthcare providers are paid appropriately for their services. The process starts with the healthcare provider documenting the patient's condition and treatment. Then, the coder assigns the appropriate ICD-10-CM or ICD-10-PCS codes. These codes are submitted to the insurer as part of a claim. Accurate coding ensures the claim is processed correctly, leading to timely and accurate reimbursement. Let's look at compliance and legal responsibilities in medical coding. Beyond reimbursement, coders also have a responsibility to ensure compliance with healthcare regulations. Incorrect or fraudulent coding can result in penalties for healthcare organizations. For example, upcoding, where a more serious diagnosis is coded than what was documented, can lead to legal consequences. On the other hand, undercoding, where not all services or conditions are coded, results in lost revenue for the provider. Coders need to follow federal regulations, such as HIPAA, Health Insurance Portability and Accountability Act, which protects patient information, and ensure that their coding is accurate, ethical, and compliant with payer guidelines. To summarize what we've learned today. 1. ICD-10-CM is used for coding diagnoses, while ICD-10-PCS is used for coding inpatient procedures. Both coding systems are critical for healthcare documentation, reimbursement, public health tracking, and research. Medical coders have a key role in ensuring compliance and accuracy in coding to prevent legal issues and ensure proper reimbursement. Mastering ICD-10-CM and ICD-10-PCS is a vital skill for anyone working in medical coding. In this class, we'll dive deeper into how to actually assign codes using these systems. Before moving on to the next chapter, please make sure you review your ICD-10-CM and ICD-10-PCS manuals. Get to know them. Read the guidelines, tab your manuals, and familiarize yourself with the layout. Thank you for your attention, and I'll see you all in the next class. Before ending the session, I'd like to open the floor for any questions you may have about today's lecture or the coding systems in general. Email me through messages in your course on Blackboard. Chances are, if you have a questions, others have the same question or have not thought to ask it yet. That concludes today's lecture. Until next time, have a nice day.